right. Welcome everyone to another Talk, Listen, Share. Tonight we have a very special guest speaker that we will be introducing later. I just wanted to introduce to all of you what Talk, Listen, Share is. Um, Talk, Listen, Share is a part of our overarching group, Shay's Warriors Life After Cancer. This is our educational arm for our survivors and thrivers. Shay's Warriors is a 501c3 nonprofit with an all volunteer board of directors that was formed in the Coachella Valley to help our cancer community thrive after treatment is over. The mission of Shay's Warriors is to inspire, inform, and empower through health, fitness, and the mind body connection to heal survivors and their families through a national network of support. Our Talk, Listen, Share is hosted by our board members every second and fourth Wednesday of the month by Shay Moraga, our founder, myself, Dr. Sonia Fung, and our team tonight, Dr. Amy Hetherington and Jeannie Parafon. And we really look forward to this amazing talk. And thank you so much for our guest speaker, Dr. Henry Tsai. And I am going to throw it over to Amy.
Yes, hi everyone, and thank you, Dr. Tsai, for joining us. As we know, bone health is a major factor in aging and cancer survivorship, especially after hormone deprivation therapies. So today, our special guest, Dr. Henry Tsai, hematologist oncologist at Eisenhower Hospital, will be helping us with his expertise in this topic. So I would like to read Dr. Tsai's bio, if I may. Dr. Henry Tsai, MDMA, is a board-certified hematologist and medical oncologist, specializing in the treatment of colon cancer and other gastrointestinal cancers at Eisenhower Health. After having moved from Taiwan at age 14, Dr. Tsai attended UC Berkeley, where he received his Bachelor of Arts in Molecular and Cell Biology, Neurobiology. He received a Master of Arts degree in Medical Sciences from Boston University and attended medical school at Wayne State University School of Medicine in Detroit, Michigan. Upon graduating from medical school, he moved to Atlanta, Georgia, for an internship, residency, and fellowship in hematology oncology at Emory University. It was at Emory where Dr. Tsai grew to love his chosen specialty, cancer care. And in his words, yes, cancer care is one of the most difficult fields to practice, but it is also the most stimulating and rewarding. There are days when I see my patients get better and I have experienced hope. I feel privileged to be a part of their process. Again, thank you so much for sharing your time and expertise. Dr. Tsai, how are you today?
Good.
Thank you.
Glad to be here.
Thank you so much. So I think I'm just going to jump right in with some of the questions. And, with our topic of bone health after cancer, I'd like to first ask you, how is bone health impacted for someone going through cancer treatment?
So bone health has several factors, cancer-related issues. So it's well known that somebody suffered what we call a skeletal event, basically fractures of any type due to cancer, that would drastically cut down on their survival. So by all means, usually if we're treating patients with cancer, we try to prevent that from happening. And as you alluded to earlier, especially not only chemotherapy, especially the hormone therapies are known in female patients, for example, ovarian or breast cancer. We knock down their estrogen even further than where they are, and that has a drastic impact on their bone health. Without the estrogen, the bone gets more brittle and more likely to break. So prevention is number one, because once you have a broken bone, your health takes a toll, and it's harder to bounce back, and it actually could affect your overall survival. So that's certainly one. The somebody who already has cancer in the bone, how do we keep it from breaking and make it healthy? So these are the things we face with every day.
Yeah, and that certainly is a challenge. what are some strategies that you think could preserve bone health during cancer treatment and afterwards? You mentioned some, again, the way estrogen would be interacting, maybe.
Yeah, so bone is one of those things where there are two teams of players constantly. There's a bone builder. Think about it like if you're sculpting, you add a lot of material to make the bone thicker, but automatically we have a team of bone, sort of like a sculptor, chip it down to the right shape and size. It's always the constant balance of these two. So oftentimes what we do is, for example, a breast cancer patient, we identify the risk of fracture. We could do a baseline bone density to see what they start with. In addition, we identify some of the risk factors. For example, if they're small, they're more likely to have fracture, what age they are in, have they had prior steroid therapy, which would have caused your bone to be weaker? Do they drink a lot of alcohol? Do they smoke a lot? All these things could make your bone much weaker. We identify them, and based on the risk factors, there are all sort of algorithm out there, but there's a one we use often called FRAX score. It could allow us to estimate the risk of fracture. And if the bone density itself show that you are already in osteoporosis range, we usually offer pharmaceutical interventions
Mm-hmm.
in the form of bisphosphonate, whether IV or PO. These are agents that make your bone thicker, and or the rank lichen inhibitors. These are another agent basically reward the bone builders and inhibit the sculptors. So in essence, make your bone stronger. If you are not in osteoporosis range, we look at other risk factors, and because in breast cancer, once we start the treatment of hormone therapy, your female hormone will drop further. So we think of that as a risk factors, and we may actively start. But on patients' end, there's stuff they could do on their own. You go, well, you're giving me medicine. Well, what else can I do on my own? Well, you all know the basic stuff. If you're smoking, you want to cut that out. If you're drinking alcohol, you want to cut it way down. And weightlifting is important to maintain your bone health. So weight training is good. Calcium, vitamin D, good diet, having good physical activity. All these things are overall helping to make someone's bone stronger.
Mm-hmm. Okay. Yeah. So you mentioned the role, just to kind of go more into this. How I know for exercise, we want to be careful. For example, I know right now we've got a lot of folks very into things like pickleball and that maybe place them at higher risk for injury or fracture. So I think I like the fact that you alluded to using things like weight training as well. So some exercises are going to help bone health of the person much more than others. Are there any other sport activities that you would recommend, or really things
So
that be contraindicated?
So absolutely, obviously, you don't want to be like Arnold Schwarzenegger. If you already have a issue with your back, if there's already cancer in your back, you want to be gentle and be careful. And ideally, talk to a physical therapist first. But on your own, if you don't have any obvious lesion, in other words, obvious injury or cancer in your back, just weak bone, all you have to do is potentially get it stronger by exercising in the small amount of weight. That could help you to get things better. And as you get better, you can increase that. But our bone is one of those things that a little bit of stress is important to get it stronger. So you kind of use common sense and oftentimes ask professional help if you need one. At our cancer centers, we have physical therapists that are geared toward cancer bone care. So those will be a good resource.
Okay, yeah, definitely seeking the advice of professionals and exercise physiology and is really a big part of a plan of care for a cancer survivor. I would think you would want to continue with that throughout your lifespan to really be monitoring your bone health after. What about nutrition? How
Well,
does nutrition help the bone health of a person coming out of treatment for cancer?
so nutrition, the basic calcium, vitamin D supplement. But beyond that, a lot of food could cause inflammation,
Yeah.
things of that nature, and that could negatively impact your health overall. So a good healthy diet will be not only for your bone health, for your overall health.
Mm-hmm.
So most of us kind of inherently know what that is. Basically, more of a Mediterranean diet, a little bit more plant based, or chicken, fish, healthy stuff that we all know. Avoid too much sugar if you can. Avoid too much fat, and basic things that we all know are healthy for us.
Mm-hmm.
As we know more and more, a lot of the modern food have a lot of supplements, not as organic as it should be. So you want to be a little bit mindful of that. What just the other day now they're officially making the diet sugar, the aspartame, as
Yeah.
possible carcinogen. So things of the man-made stuff, you want to be kind of cautious about it.
Yeah, I've always, with my patients and in general, I think a good rule is the closer it is to the ground or to the earth or to nature, the probably the better it is for you, less altered. So, would you happen to have any resources that you know of or suggest that maybe we could list with this video in the show notes?
Yeah, there should be resources available online on
Yeah.
with the American Cancer Society.
Mm-hmm.
But again, for those who are being treated, our cancer center also have dietitians that specialize in recommendations for cancer patients' diet, so they could make a tailored one-on-one recommendations. So those are options available.
Yeah, and I think oftentimes with regard to diet and with supplements, especially, we have a lot of um, people that are really trying their best to meet those nutritional needs at baseline. But when we talk about bone health, how much more vitamin D or calcium are we talking about? Would be recommended for someone?
So
Survivorship.
that may change based on your situation, but in general, you're looking at at least 1,000 of calcium and at least 800 units of vitamin D. Sometimes I go 1,000 each. Some of the doctors are much more aggressive based on feedback, based on your lab value. But
Yeah.
minimally, you should have those in your diet. Diet plus a supplement. And there are situations where you might be a little different. Let's say some patients have a tendency to accumulate calciums, and then you got to be careful about too much calcium. So you may basically general rule of thumb is what I mentioned earlier. But if you want to go higher, you may want to check with your doctor first,
Yeah.
just to make sure.
Okay. Now, um, I wanted to kind of get an idea what kind of advice you would give to a person going through cancer or post cancer that would best relate to your practice. And this is kind of going off a little bit of the topic of bone health after cancer, but just in general, what's some advice that you would give a person going through this cancer experience
You mean during or after?
after? Mm-hmm.
So after congratulations, you've been through a tough time. It's time to kind of normalize and give yourself a little break, and try to recenter yourself with reconnect with your family and friends. I know they've been there for you during those tough times, and but focus was getting you better. Now that you're better, you participate in their lives, and just mindful of your everyday moments, and express your gratitude, and live as healthy as you can, and have a purpose life, like what all of you guys are doing, which is great.
Oh, thank you, Dr. Tsai.
Yeah.
And I love that you bring the idea of mindfulness and gratitude forward, because definitely that is a big component of that healing that is an ongoing process for someone who has experienced cancer and is now in survivorship. If you could summarize your practice in 3 words, what would they be?
Well, hmm. I'm gonna borrow one of your names, the Warriors. I love that, but I also add hope and love. So I think 3 words will be kind of a separate but somewhat joined. It.
Yeah, hope, love, and warrior spirit,
Yeah.
for sure. Thank you. And if someone wanted to know more about the importance of bone health following cancer treatment, what book or books would you suggest? Is there anything that you think is out there that's really valuable, easy to get into? You know, we're talking about everyone.
Yeah.
Do you have any suggestions of something that would be helpful?
So other than the General American Cancer Society, there's a website called NCCN,
Uh-huh.
and that's our basically our national cancer organization. Every major institutions, including MD Anderson, Dana Farber. We constantly update our guideline, but we also have resources for patients. There are videos and slides and patient level language that would be able to give you some good understanding, not only of cancer, but also of bone health.
Yeah, yeah. We want things to be accessible to everyone. We want to empower our warriors. And I think just to leave this a little bit, this discussion, which has been wonderful, if you could design a t-shirt for cancer, what would it say, Dr. Tsai?
Kind of the key things I always think about. The 3 things we talk about: warrior, love, and hope. But gratitude, I think it's a good one. So 3 words now. So that's a little bit. That's 4 words now. So perhaps I would try and remain a positive attitude by having the love, gratitude, and hope.
Love, gratitude, and hope, and a symbol of some sort to join
Mhm.
them together. Well, I wanted to hand off a little bit to the others that are helping with this discussion to see if there's any questions or if there's anything we'd like to ask Dr. Tsai, or if any of our um, those watching us right now have any questions that they would like to ask more specific, since we have this wonderful expert in oncology here willing to answer our questions. Oh, I can't hear.
There we go. I've got to unmute all of
I
us.
saw lips moving.
Oh, I know that we did have, I'm going to pull it up here. Here we go. There's a question from Jason, who's in Wisconsin. What precancer diagnosed lifestyle and health decisions may impact bone health in cancer patients?
Oh, okay.
Okay.
So the question is before the diagnosis. Is that the
So is
question?
there
Before
anything,
diagnosis, what kind
yeah,
of lifestyle?
pre-cancer, if there's any type of lifestyle and health decisions that maybe make us make our bone health a little more sensitive to cancer treatment? I think that's what I'm understanding.
Okay, so we've done a lot of study on those, even for patient who's doing undergoing treatment now. So I will get back to that question a little bit, but it runs in pre-cancer and during cancer. So we've done studies showing the people that do the best are, even while they're getting treatment, that they are mindful of their exercise and good diet. So even though during the chemotherapy and or other therapy, you're wiped out by dealing with the disease, you're tired, you're fatigued. There's no, you're like, you tell me to go to exercise, I could barely get out the couch. But those who could do whatever they can, even just get up, walk a little bit, helps. As far as going back to the question, as far as bone health pre-diagnosis, it's the same idea. Basically, avoid things that could be damaging to your bone, i.e., smoking, alcohol, and then lack of exercise, and having good enough supplement, mindful of what you put in your body. Those would help quite a bit. So if you maintain that, it will be in general much better. And we also have data suggesting people pre-cancerous, what kind of people tend to survive better. Obviously, if you go into cancer already are relatively healthy, it's much easier for you to take a harsher treatment, and it's much easier for you to sustain. And we also, as far as the mind body, it's strange. The one that survive typically are either very positive or they're crotchety. They are angry at the world, but they got this strong drive to survive, and they tend to do well.
Yeah.
They have that warrior
Warrior spirit.
mindset, right? I love that. Thank you.
Absolutely.
Let's see here. I know we have a few more that just came in. Sorry, I'm going to finding them. We have, I'm not sure if this is a question or if this is a book. I'm reading Next Level, Your Guide to Kicking, Feeling Great and Crushing Goals Through Menopause and Beyond. I think maybe the question was, have you ever read that at all?
Personally, no, but I think that's great. It's coming from someone who's been to that experience, have some advice or offer.
Awesome. Good suggestion there, Carrie. Thank you.
Now, Dr. Tsai, you have homework. You get to read a book. Another one.
From Sally in Arizona.
Absolutely.
Did I understand correctly that having a fracture after a diagnosis of cancer affects your survivability risk of relapse? If so, how exactly? Great question.
So, not necessarily risk of relapse. It's more on your overall well-being. So, as your body and organ are under stress with cancer and treatment, the last thing you want is have a broken back or broken hip. That sets you back, not only as well, you may not be able to get back on chemo because you're dealing with a fracture, the pain, incapacitated, and when you're not able to move, your physical well-being strength goes down, and it cuts into your ability to survive. And it kind of run back to your same thing, that is somebody come in relatively stronger dealing with a cancer diagnosis versus somebody who's already bedbound 24/7. You know that someone who is already bedbound 24/7, very fragile to begin with, they're not going to do as well. So are to try and prevent adding another heavy stone on someone's back, so to speak. So it's not necessarily guide related to recurrence, but guide to it's adding to the survival, because everything counts in your survival. So a healthy body and less complications would help. People, it's been estimated, people who have complications from the fracture, as far as being a cancer patient, typically do much worse than the one that don't have a fracture.
Awesome. Thank you. Thank you so much. Sonia or Jeannie, you guys, I'm going to flash these up, and why don't you guys take these questions? This is from Twitter.
Okay, we have from Twitter, what are some of the best exercises to help build bone health slowly?
So cardiovascular certainly is helpful for general conditioning. But as I said, bone relies on a little bit of stress. Now, obviously, if you're not necessarily lifting weights, a whole body exercise, simple stop walking, a little bit of squatting using your body weight is perfectly fine. If you're able to do push-ups, things of that nature. So basically, a little bit of resistance training, i.e., you could do bands. You don't have to lift weights, but basically give your bone a little stress so they have ability to respond to and make themselves thicker.
So perhaps some isometric type exercises too, maybe would be helpful. Is that a good suggestion as well?
Absolutely, absolutely. Basically, anything to give a little stress to your joints and bones so they could rise to the occasion.
Okay, so Carrie is curious about that bone break as well. She says, I'm just coming off of a stress fracture in my foot and wearing a boot for about 6 weeks sucked. Oh, Carrie. Yeah, stress fractures and wearing a boot, that really cuts into your ability, your mobility, and just being able to continue in your survivorship doing what you want. So I can see definitely how frustrating that could be. I don't know.
Is there a balance? Because I know Carrie and I know how active she is with spin and with running and all of that.
Yeah.
Is there a balance so that she doesn't, or anyone who has gone through what we have, find that balance of not, we're trying to push ourselves to get stronger after everything, but what is that balance? How do we find that? Can you speak a little bit on that?
So I think key thing is to kind of know your body and be honest and with your body. If you know you're just not up to it, it's okay to take a little break and be gentle. Yes, our goal is to get it stronger, but you got to take baby step depending on where you are. So if you have a stress fracture, you're not going to be able to go to the gym, but certainly move around, walk around whenever you can. And you need to take a break, you take a break. You need to take a nap, you take a nap. So it's a marathon process now. So if you have setback, don't. I know it's frustrating, especially if you're used to working out quite a bit. You just have to get your back on it. If you make it today, that's a plus. Tomorrow you can, that's okay. And the next day you start. So I think it's a lot of being patient with yourself, but just keep the ultimate goal in mind and gradually increase. And listen to your body. If it hurts quite a bit, you know you're not supposed to push it.
Sometimes your warrior, it's what I hear is sometimes your warrior strength is manifested by showing your ability to acknowledge a need to rebuild your warrior strength. So, and that can be hard.
And
to
I
let
know
your
that
body heal and rest.
we've already covered this topic previously, but one thing that's really important is knowing your limitations, as well as making sure that if you're doing something such as running, which is where we can get some stress fractures, that you have somebody who is an expert watch your form, look at your arches, make sure you have good running shoes, appropriate equipment to do the exercises that you're doing, because in addition to working through the fatigue and getting stronger, you want to prevent injury. And how we prevent injury is making sure that we're doing things correctly. It looks like we have Yoon Hee Rhodes Ko. Hopefully I said that name correctly. How harmful is nuclear bone scanning to our bodies? How often can a post-cancer patient get bone scans? Thank you for your answer in advance.
So the most common stuff we're talking about bone density is simple X-ray, and there's two part to it. Part of it is also insurance guideline, and so typically it's every 2 years for bone density. Sometimes we can get away with once a year. That just measures whether or not you're in how dense is your bone. Are you in osteopenia range, a little poor bone, or you already have holes in the bone, osteoporosis? Those are like relatively similar to X-ray, so it's not super intense. So it's not super harmful. Now, if you talk about nuclear bone scan, that's a different scan. That's a scan we oftentimes use as a way to look for cancer in the bone, and so most of the time used for diagnosis. And so we don't routinely do that much. Maybe at the beginning of diagnosis, you want to make sure it's not in your bone. Oftentimes, so we use a lot of PET scan, which covers that. Now, those scans are much more, as far as radioactivity, much higher than the simple X-ray. So, in general, bone density that a non-cancer patient get, like a menopause patient, want to make sure their bone's healthy, and not cancer at all. Your primary care doctor will most likely order those DEXA scan every 2 years or so, and those are relatively mild.
Thank you for that. And I think this is a follow-up from Sally's question earlier. She says, it applies during active treatment, not so much during post-treatment. Looks like she has another. I think some of our warriors are talking together.
Yeah, this is good. We got some good discussion going on.
I love it. Good. And I think, I know there was a question that I saw about blood clots somewhere.
I think that was Amy.
Oh, yeah. So one of the things that I know that there is that relationship too of when you have had cancer, your body remembers in many ways that this happened. So one thing that I know is that blood clot risk is higher. And if someone is not as mobile and is not doing exercise, you are higher risk for blood clot, correct? And so I think that having that understanding that mobility is good, rest is good, but that there are risks of not being mobile. And we all need to just acknowledge that.
One of the things I want to commend you on, Dr. Tsai, is because, or praise you on, is the fact that you said use your body weight and just walk and all of that. And I want you to be my doctor. I literally teach that all day long in the yoga community or in the mindfulness community, because breath, body, and movement are the three things that goes back thousands and thousands of years. So just getting out in nature, it helps that mindset right away. And some of the survivors that I work with, they hurt because they sit quite a bit. And I just tell them, go out for 5 minutes, just 5 minutes, and walk as far as you can for 5 minutes, and walk back as far as you can for 5 minutes early in the morning or late at night during this time of year, of course, or just in the house. Because not only does that help their fluids start to go through their bodies and their lymphatic system and everything, but it's so simple and it doesn't cost anything. Just the fact that they know that it's going to be a little painful on the way, but that pain or that uncomfortability will start to decrease as they start that movement. Like the rusty, what is it? The rusty wheel. You have to put some oil on it and get it going again, and then it starts going and going and going. So I thank you so much for telling that to your patients and telling that for the audience tonight, because it is so important that they hear that all the time, and that's integrated with what your care is giving all of us.
And I also like the fact that you mentioned making sure that you're also eating as anti-inflammatory as possible, because that makes a huge difference in patients' pain level and exercise tolerance and energy and all the things. And it makes everything work better together. So it's not just one thing, it's all the things, right? So I thank you for acknowledging that.
Dr. Tsai, I have a question for you. So we talked about calcium and vitamin D supplements, but there's a lot of supplements out there that individuals will read, and maybe there are in their post-cancer treatment, so they're not maybe seeing their oncologist anymore. We'll see things like glucosamine, chondroitin, just things that are labeled as joint health. Turmeric is really big right now. Is there anything that you would recommend, and B, that you would like cancer patients to stay away from?
So I think a part of it may defer to Sonia because she's the expert in that. But in general, I'm more of a naturalist. So I prefer you get most of your nutrition through food. So if you eat a healthy, well balanced diet, you may be able to capture most of those. Supplements, I'm not against at all. Just obviously, you gotta know the source, credible source. Don't buy something someone mixed in their garage. And so those are things you kind of have to watch out for. During treatment, I'm a little wary sometimes just because depending on the treatment we give, immunotherapy, I'm not so much concerned. We use your own immune system to fight cancer. Traditional chemo, though, it actually kills cancer by causing more oxidation, which in its initial stage is what may be partially generating the cancer at the very beginning. Because there's a lot of causes to cancer, including damage to your DNA, and infection could lead to inflammation. Those could trigger it. But sometimes when we try to treat them, especially with radiation and chemo, the way they kill the cancer is causing somewhat of an oxidative change. So sometimes too much an antioxidant during treatment might lower your ability of getting effective kill from chemo. So during the treatment time, I have them back off a little bit, but afterwards, you do whatever you want to make yourself healthy and again. Sometimes there's a little exception, but overall, I think I'm more of a naturalist. But I'll defer to Sonia for more detail on those.
Yeah, typically I definitely space out time. So take a supplement break prior to and after your chemo treatments. And of course, during radiation, you're mainly focusing on getting the nutrient support through your food. So that's my main advice to my patients. And definitely doing, like, we do at least a 48-hour break, so no supplements and or vitamins, minerals, 48 hours prior to and after your chemo treatment, so that it washes out of your system. You get the chemo, it does its job, and then you can continue on with your treatment protocol after that.
And I guess as the one person who went through chemo treatment on here, food was a huge part of that process. Clean, organic, lots of nutrient dense, making sure I had the right supplements. I know it. I had reached out. Eisenhower had a nutritionist, so I went to their nutritionist there and learned a little bit of stuff that I didn't already know, even though I was already kind of, really, really clear on that. I did away with coffee for a whole year. Yes, I did. That was hard, but I think, and I don't think, I don't, I don't think that coffee is a bad thing, but it was just something that was a stimulant that really didn't work with my body. And so I had this opportunity for a year to learn different foods that worked with my body and the foods that didn't. But I'll tell you, when I had my chemo treatment on Thursdays, I went to Sherman's Deli and had a big piece of their strawberry shortcake, and it was delicious. So it's all about balance, right?
Absolutely.
That's okay. It's helping the oxidative processes right there.
Yeah. All right. We have one more question, I think, that just came in from Angela down in, I think she's in Newport.
So I had follicular lymphoma, and the PET scan showed a lesion in my spine requiring radiation to the vertebral body. Does that increase my susceptibility for increased fracture in that vertebrae?
So it depends on how much these are there, what's already been damaged. Let's say if the lymphoma is already eating to a big chunk of that vertebra, then certainly actually the cancer itself is more of a risk of breaking it.
No.
Uh-oh.
Uh-oh. Did we lose him?
Come back, Dr. Tsai.
I think
Where'd he
he's
go?
here. He must have just cut out.
Yeah.
You're cutting out, Dr. Tsai. Come back.
Okay. Technical difficulties. It happens.
Yeah.
All
That
right.
does.
So, Sonia, we were talking about
Yes.
waiting for Dr. Tsai to come back. Supplements versus what you can get out of nutrition. So, like what foods for somebody like glucosamine chondroitin is the closest thing we have to an oral cartilage. What foods can kind of help with supplementing that with that cartilage breakdown and bone density loss can we find in our foods?
I love bone broth.
Okay.
So it's a great source of all of your glucosaminoglycans, and it is a very nutrient dense, easy-ish
I love
to
bone broth.
make. Yeah,
Well,
and a lot of people are making it now too. Hi, you're back.
Oh,
I
What superpower?
I know. I just lost connection there. So to kind of finish my thought, I don't know how much you have heard, but to answer about follicular lymphoma and whether or not radiation causes more problem. So it depends on what has already happened. So if the lymphoma is already destroying a big chunk of the vertebra, then that's more likely to cause immediate threat. Radiation, on the other hand, lymphoma is very sensitive to radiation. So if you get a good response, it could immediately recede. The tumor could let go and let your bone recover. But occasionally, radiation could also itself could maybe cause a little bit of extra power and push it to break. So your radiation doctor would let you know how much it is. But fortunately, if you have lymphoma, generally they don't have to have a lot of radiation. They're very sensitive just to even a little bit of radiation, they could just melt away. So hopefully, it will leave your bone intact.
Awesome. Well, that I think will conclude the majority of our show tonight. Dr. Tsai, thank you so very much for taking the time out of your busy schedule to talk about bone health and survivorship. I know I learned a ton, and we had so many great questions and answers tonight that really helps our entire community, because survivorship, we still have so many questions, and this is a great way to be able to share and talk and listen, right? With that being said, I know that next Tuesday at the Annenberg, that the Eisenhower is doing the Selby Dunham Community Series lecture, and it's actually on cancer transitions They're talking about exercise for wellness. So the awesome thing about that is Jim Reed, who is the physical therapist over there, and myself will be speaking on that topic. So if you're available from 12 until 1:15, please join us over at the Annenberg Center, and it will be actually talking about particularly this topic of making sure your bones are healthy and exercise after cancer survivorship. If you love our mission, you love what we do, please help us spread the word. Send a Facebook like message, Instagram, Twitter. I mean, there's so many social platforms out there now. We're on them all. Please, in survivorship, continue to be that warrior and live in love and hope. Thank you for joining in tonight. Sonia, Amy, Janine, and Dr. Tsai, thank you.
Thank you, everybody.
Thank
Take
you,
care of your
everyone.
lovely bones, warriors.
Good night.
Thank you, everybody.
Good night.
Good night.
Bye.
Good night. Good night.